Ever since the second wave of the coronavirus pandemic cornered communities, statistics of new infections and fatalities have been skyrocketing, enveloping the country with necessary fear and grief on a daily basis. Ministry of Health says so far about 1,873 lives have been lost to the pandemic since the outbreak, though majority of these are as a result of the second wave.
The harmonized death count currently stands at 1,873 deaths, bringing the case fatality rate to 2.3%. Of these deaths, 1,127 were PCR confirmed, while another 746 are deaths confirmed clinically as probably due to COVID-19. And so our statistics will now be capturing the numbers, including the probable deaths.
Ugandans are reportedly resorting to the use of both scientific and traditional concoctions to shield themselves and their loved ones against the virus. Even as this has to some extent yielded promising results, Dr. Ruth Aceng warns the populace against unregulated use of these remedies.
I'll bring to light some of the drugs and the side effects. And we'll start with paracetamol or acetaminophen, also known as Panadol. This is indicated for high temperatures or fever. It should be avoided in patients with liver disease as it can worsen the damage to the liver. Therefore, it should be taken on prescription. The second is the vitamin A, vitamin C, vitamin D, and zinc. Many of you will note that vitamin C has fallen out of our prescription list, and therefore we will not talk about it. The rest, vitamin A, vitamin D, and zinc, support the body to build immunity to fight COVID-19. Taking too much of these can cause nausea, diarrhea, and stomach cramps. That COVID-19 patients with blood oxygen levels below 92% should report to hospitals for assessment and further management. Unregulated use of oxygen may cause damage to our lungs, so avoid it.
Meanwhile, health experts have explained why people who have just recovered from coronavirus should wait to take their second vaccines even as they are due.
After 90 days from the COVID infection to get a second dose. Yes, you have to get a second dose. But because you still have antibodies from your first infection, the take of the vaccine immediately, if you take it immediately, may not be as strong. It may not give you as strong a reaction as when you wait several days or several weeks before you take a second dose. But you still need to have a second dose in order to be fully really covered. And the reason why you need a second dose is because the infection you have got, we are not too sure it has stimulated the body enough to give you a good boost of antibodies to protect you moving forward.
Dorcas Kimono, UBC News.